I have given notice to question addressed to the Honourable Prime Minister. To ask the Honourable Prime Minister, Minister of Defence, Home Affairs and External Communication, and Minister for Rodrigue, Outer Island and Territorial Integrity, whether, in regard to the proposed easing of confinement restrictions with effect from 15th May 2020, he will state if necessary measures are being taken to control the risk of a second wave of COVID-19 infections, including by strengthening our healthcare preparedness and capabilities. B, extend the additional and temporary financial support to households most affected by the lockdown economic activities throughout the easing up phase. And C, ensure that all rules and guidelines are put in place in relation to the proposed phased resumption of economic activities after consultation with businesses, trade unions, and civil society.
Mr. Speaker, sir, it is with a sense of relief that I answer this private notice question, as facts and figures testify that our nation has till now successfully managed to weather the storm caused by the COVID-19 pandemic. As I announced in my statement to the House on 20th March 2020, the government has been acting with much foresight in the management of COVID-19 crisis and had already taken a number of preventive measures as from the 7th of January 2020. As the House is aware, as soon as the first case of COVID-19 was detected on 18th March 2020 in Mauritius, a sanitary confinement was imposed as from 20th of March 2020. A curfew order was issued on 22nd of March 2020, which was subsequently extended on 3 occasions as it was considered necessary and expedient for the purposes of preventing the spread of coronavirus and to protect the health of the population. Mr. Speaker, sir, a confinement is an important and powerful component of control of the outbreak of infectious diseases. The timely and effective implementation of this powerful measure as part of a comprehensive package of public health response and containment measures has contributed significantly to contain the spread of the disease in our country. As a matter of fact, for the last 8 consecutive days, there have been no new reported cases of COVID-19 in Mauritius. Moreover, we have presently only 3 active cases. Mr. Speaker, sir, imposing or lifting a lockdown are measures which are directly related to public health. Any decision in relation thereto should therefore be based on scientific evidence and guidelines. In regard to the government's strategy and action plan for easing some of the curfew restrictions which were announced on Friday last, I must say that it is a plan that has been carefully thought out, based on scientific advice, and is precisely geared towards preventing a resurgence of the epidemic. In fact, at its meeting held on 10th of April 2020, Cabinet agreed to the setting up of a National Steering Committee under my chair to develop a post-curfew strategy and an action plan for a phased resumption of economic and other activities. The committee was composed of several senior ministers and officials. In addition, 4 subcommittees were set up to make appropriate recommendations to the National Steering Committee. The government strategy and action plan hinges around one central concern, that is, the continued protection of public health, which remains its topmost priority. Government intends, by all means, to avoid the risk of a possible resurgence with a second wave of COVID-19 infection. Any such resurgence would not only jeopardize the gains achieved so far in terms of containment of the disease, but will also put a heavy strain on our health services and the economy in general. Hence, the decision of government for a phased approach for the resumption of economic and other activities. The main features of the government strategy to prevent a second wave include the following. 1. All secondary, primary and pre-primary schools in Mauritius to resume in August 2020 in a phased and staggered manner. 2. Wearing of masks and observing social distancing in all public places. 3. A ban on all public gathering. 4. Cinema halls, markets, malls and casinos to remain closed. 5. Access to horse racing and public beaches will not be allowed. 6. Maintaining present restrictions on passenger flights and cruise ships. 7. Shielding our elderly and vulnerable people. 8. A phased resumption of activities in the public and private sector under strict sanitary rules. And 9. Encouraging work from home and flexible working hours, amongst others. Mr. Speaker, sir, in regard to strengthening our healthcare preparedness and capabilities, the government has already taken a number of measures in terms of procurement of essential medical supplies and equipment and implementation of a number of protocols and training of staff. Moreover, government is envisaging the introduction of the following new legislation to enhance our preparedness and response to infectious diseases. 1. A COVID-19 bill. 2. A new quarantine bill to replace the present one, which dates back to 1954. And 3. A new Public Health Act to replace the present one, which dates back to 1925. Moreover, in line with our strategy to enhance our preparedness, we have increased our testing capacity to face any resurgence. Private health institutions have also been approached in case of workload saturation at our central health laboratory. Our health services are already prepared to face any resurgence of the epidemic. Accordingly, in pursuance of our strategy, we are doing the following. 1. We are increasing our testing capacity of PCR tests. 2. We are carrying out rapid antigen tests to know the dynamic of the epidemic. 3. Contact tracing by well-trained teams is being maintained. 4. 5 COVID testing centers in the 5 regional hospitals are being set up. 5. Treatment of patients at ENT hospitals, 20 in the ICUs, and if need be at Suyak Hospital, 10 ICUs as well as in other hospitals, and a total of 60 ICUs and 300 beds are available for other COVID patients. Mr. Speaker, sir, in regard to Part B of the question, government has set up the Self-Employed Assistance Scheme to provide direct support of 5,100 rupees per month to all those who are in business or a tradesperson operating in the informal sector, for example, mason, cabinet maker, plumber, hairdresser, and so on. An artist is entitled to join the assistance scheme also. I am informed that in respect of the Self-Employed Assistance Scheme, the Mauritius Revenue Authority has, as at 4th of May 2020, received 253,102 applications, approved 189,476 applications, paid for the period 16th March 2020 to 15th April 2020 to 177,714 self-employed, representing a disbursement of 906 million rupees. And for the period of 16th April 2020 to 30th April 2020, an amount of 2,550 rupees has been paid to 138,670 self-employed, representing disbursement of 354 million rupees. Moreover, a wage assistance scheme has also been set up to provide financial support to employees of the private sector to ensure that they have a salary at the end of the month. 15,787 applications from enterprises have been received for the month of March 2020, out of which 14,271 have been approved. An amount of 1.6 billion rupees has been paid for 15 days of the month of March 2020 in respect of 246,374 employees working in 12,668 enterprises. For the month of April 2020, 13,286 applications were received, of which 12,380 have been approved. An amount of 2.8 billion rupees has been paid in respect of 208,887 employees. With regard to household loans, the Bank of Mauritius has requested commercial banks to provide a moratorium of 6 months on capital repayment of household loans. The Bank of Mauritius will bear the interest payable by households earning less than 50,000 rupees per month for the period 1st April 2020 to 30th of June 2020. Mr. Speaker, sir, as a caring government, we have extended both the self-employed assistance scheme and wage assistance scheme for the month of April 2020, and same will be extended for the month of May 2020. As regard future months, a decision will be taken depending on the evolution of the pandemic to extend the financial support to vulnerable groups through the Covid-19 Solidarity Fund. Mr. Speaker, sir, in regard to Part C of the question, I am informed that Business Mauritius will implement a protocol on post-curfew work arrangement which has been cleared with the Ministry of Health and Wellness. As regards the public sector, the Ministry of Public Service, Administrative and Institutional Reforms has issued a comprehensive circular to all ministries and departments providing guidance for the phased resumption of activities, including sanitary rules to be followed at the workplace. The public has also been invited to make suggestions on COVID-related matters on the Be Safe Maurice platform. I must say that we have all along been adopting a consultative approach with all stakeholders, including Business Mauritius, MCCI, MEXA, ARIM, trade unions, and others. Mr. Speaker, sir, the social and economic disruption of this crisis will be deep, broad, and long-lasting. It is in our hands to limit the damage and to establish the foundations for strong rebound afterwards. I'm confident that together, as a united and resolute nation, we shall rise to this daunting challenge.
Thank you very much. It's a long, winded reply given by a Prime Minister, but the truth, the naked truth, is different when you talk to the common man in the street. Can I ask him whether he had consultation with all stakeholders, including non-governmental organizations, and why did he refuse to invite leaders of political parties to have a full-fledged consultation?
Well, Mr. Speaker, sir, as I have said, we have had as wide consultations as possible. One must imagine in what situation we have been and what we have been facing. It is something which is unprecedented. And therefore, we have been in touch with as many partners of the economy and social sectors as possible. Now, with regard to the opposition, I have thought it fit to be in communication with the leader of the opposition on several occasions. And I have been informing the leader of the opposition of a number of actions that we have taken. I have been also listening to certain observations and remarks and criticisms also by the leader of the opposition. And therefore, we have reached a situation now where we are meeting in this very August assembly in order to, of course, answer to questions also from the opposition. So I don't see how we have failed in our duty to consult, as I say, as much as possible, and the Honourable Leader of the Opposition as well, who represents the opposition.
Speaker, sir, if
Can you wear your mask, Honorable Leader of the
it can make, sorry, with all due respect, it can make breathing difficult, huh? You know, but I agree with you, but you have to understand, huh? Okay. Yeah. Can I ask the Prime Minister whether effective leadership, like the one being led by the President of South Africa, means wide consensus after consultation with all stakeholders? Because if the public is not won over, irrespective of what government does, the policy will be one of failure. What people want, the truth, nothing but the truth, and trust. If you don't have the trust of the public, then you are in the doldrum.
So, Speaker, sir, I have been following what has been done in other countries. Of course, I don't pretend to know everything that has been done in other countries, including South Africa. And therefore, I will refrain from commenting on what has been done there. And since the Honourable Member is mentioning as an example South Africa, I hope he also looks at what has happened in Singapore, for example. This is a country where on so many occasions we say that we need to follow the example and so on. So what has been done by other countries, again, I am not going to comment. But I can say, as I have replied in my answer, that the policy, the measures that we have adopted as a government has been, first of all, quick to react, bold decisions, in fact, courageous decisions, which has led us to where we are today in terms of only 3 active cases. I must say I'm very sorry that we have had 10 deaths. And in fact, I seize this opportunity of expressing my condolences to all those families and friends who have been aggrieved by those deaths. But there have been also so many cases of people who got the virus and who are now out of the treatment centers. Some people who are now also out of the intensive care unit. So we must look at facts and figures, what we have been able to achieve so far. And what I'm saying is that we should not, because of that, relax, and we should not say that everything has been done now, and therefore we can go back to life as we used to be before the Covid-19. We have to be cautious, and I'm happy that the question of the Honourable Leader of the Opposition starts with control of the risk of a second wave of Covid-19, implying also that we have done well for the first wave. Well done, well managed. I take it like that. So let us also together, face this challenge that we will do everything that is possible not to have a resurgence of this virus.
Speaker, let me remind the Prime Minister, when I put the question on the 3rd of February, and I issued note of caution that government has to tread cautiously and err on the principle of caution. What did I say? Whether we had enough personal protective equipment, whether we had enough tests, whether surveillance and monitoring was being conducted as should be at the point of entry. And what was the answer from our friends sitting on the government bench? Laughter. But laughter is not the best medicine, because for far too long there has been complacency and poor management. And had they paid heed to what we have said, things would have been different in respect of mortality and morbidity.
Mr. Speaker, sir, complacency and poor management has led us to excellent results. I leave it to the people, for the people to appreciate. But you are not the leader of the opposition. Let the leader of the opposition.
No cross-talking, please.
So,
Question and answer.
Mr. Speaker, sir, let me say how incorrect the honourable leader of the opposition has been when he is asserting that we have been short of, I took note, he said personal protective equipment, tests, surveillance and monitoring that we didn't do. Not at all. In fact, we had sufficient at that time. In the meantime, we have ordered sufficient equipment to face the future also. I must say, I must be having the figure somewhere. Up to date, we have already, I believe, airlifted about more than 300 tons of sanitary equipment and medical items to Mauritius. And there are others also coming, because we have been planning in case there is a worst-case scenario for the future. So in case of PPEs, in case of testing, we are one of the, you know what the media, international media has said recently, BBC. BBC has been saying that we are amongst the first countries topmost country in Africa for having done so many tests per capita. So all this, in fact, has brought us to a situation where we have been able, we are succeeding. But again, as I say, a word of caution. A word of caution, because it's not yet over. We have to keep on. We are fighting a war. We are fighting a war against an invisible enemy. That makes it even more difficult. So let us not be playing politics on this issue, and let us join hands together in order to fight this virus.
I ask Prime Minister, since he's so keen to take everybody on board, can I ask him why is it that the National Risk Reduction Committee has not been taken on board? Knowing perfectly well that we have to deal with a disaster, there is a national emergency, and I would like to know why is it that the services of the National Disaster Risk Reduction Committee have not been taken on board?
Well, Mr. Speaker, sir, I have all the time involved the Commissioner of Police, the Deputy DCP also, in our meeting, everyday meeting that we hold, and in also other meetings. For example, the steering committee, the Commissioner of Police, the DCP, they are members of that committee. Who else? I think we can imagine who will be, of course, bring their expertise in terms of how to go about to fight this virus. Now, let me say one thing also to the Honourable Leader of the Opposition. Yes, there is this Disaster Management Committee, but this has always been geared towards cases of natural disasters like cyclones, floodings, and so on. Here we are faced with a virus, a pandemic, and therefore, you know, the Commissioner of Police is there, is a member of the committee, and I don't see why we need to get now all the other members to be present in that committee.
Can I ask the Prime Minister, in view of the seriousness of the matter, and we are all very keen to see to it that there's no resurgence of this pandemic, of the coronavirus, can I ask him whether there will be risk assessment being conducted by all companies to ensure the safe return of staff to site of employment? Site of employment.
Well, we have a protocol for resumption of economic activities. And this has been worked out together with Ministry of Health, together with WHO, and we are also being advised by eminent persons so that this protocol now has to be put in place and people have to follow this protocol. Whatever the most important thing, Mr. Speaker, sir, is what we are doing here today itself in this August Assembly. Physical distancing, wearing of masks, and taking all precautions in order not to be able to be contaminated. And of course, there are, depending on which sectors we are talking, there are going to be specific conditions that will be put in place.
Can I then ask the Prime Minister whether in respect to the action plan and the roadmap in relation to protocol, to dateline, to indicators, and to option, whether he can lay copies of these plans on the table of the Assembly?
Well,
everybody to see.
Mr. Speaker, sir, I have mentioned, I think the Honourable Leader of the Opposition is...
Table of the Assembly.
You want to be laid, but look at what... Did you hear... No, what I'm saying, I'm serious. I was not making a joke. I was saying, Mr. Speaker, sir, I have mentioned that there are bills that are being prepared and that will be laid in this August Assembly. Can you imagine we have a quarantine bill, a quarantine act, a public health act that dates back, I won't repeat what I've said in my answer. These have to be reviewed. There is a new COVID bill coming. So, apart from all the measures that we have already taken now, there are other measures that will be contained in those bills. And then we have to see that we make it enforceable. For example, wearing of masks is one example. I won't have to go into all the details. So this has to be enacted. So I will ask the Honourable Leader of the Opposition also to be patient, because in the very near future we will be coming with those bills.
Before I allow others to come in. Can I ask the Prime Minister whether the decision to lift off, to go for partial lifting of the lockdown, whether this was carried out as a result of advice tendered by the special advisors on scientific matters, and whether a metric called RO was taken on board to assess the rate of infection.
Mr. Speaker, sir, first of all, I think the Leader of the Opposition maybe is confused. We are not lifting the curfew. It's not even partial. What we have done, we are extending the curfew, but we will allow a number of activities to be carried out. Now, of course, we have taken into consideration, first and foremost, health issues. I have said the priority for this government is to protect the health of the nation. So health, first and foremost, and of course, we also look at the situation, how it has evolved, and we also, of course, take into consideration economic matters, because people have to be able to work in order to earn a living. The economy has to get back to track, but we are doing it in a phased manner so that we make sure that as much as possible we put the least risk for our people to be infected.
Has he been made aware, Mr. Speaker, has Prime Minister been made aware that pensioners are yet to obtain the pension, that when it comes to those working in the formal and informal sectors, there's been no disbursement of the money that they're entitled to, and there's undue delay at the level of MRA in respect of applications that have to be processed, notwithstanding that there's no clarity in respect of those running small businesses working from their own places. That's why I said to Prime Minister, there is no need to announce a lot of measures, but when it comes to implementation, we're neither here nor there. Can I impress upon Prime Minister to see to it that all these issues are addressed in a forceful and meaningful manner?
Well, first of all, Mr. Speaker, sir, we have done something which is exceptional, and for which, in fact, pensioners have been, I have had many comments and messages from pensioners to say how they appreciate that apart from those whose pension money are normally credited to the bank, those who normally come to post offices to queue and collect their pension money, this time government has organized, together with the help of the police, of course, with the post office, Social Security, that pensions are delivered at home. They are being paid at home, you know, and it's not only pension for their old age, it's for Social Security also. It's also for the ex-servicemen pension that they get. And now, so that I answer all the questions that have been put, the informal sector. Well, this is, again, this is the first time that we are putting in place a system whereby we are supporting financially, direct financial support to the informal sector. And therefore, of course, there's bound, maybe, I can admit that there can be some delay, but the leader of the opposition cannot say that there is no clarity. There is eligibility criteria which have been widely ventilated. People know who are qualified, who are eligible, those who are not eligible. And I must say, you are talking informal sector. Let me remind you that during the financial crisis and economic downturn, in 2008, the Labour PMSD government, they came with two stimulus packages. And there was, where was the informal sector? Well, the informal sector was completely forgotten. Not one person has been financially assisted by the informal sector. And now you're telling us what we are doing, how much money I have mentioned, we are paying, we are supporting the informal sector.
Leader of the opposition, one last question.
Prime Minister, if he's caring to raise the threshold of money allocated to those people and to increase it to minimum threshold, minimum
Well,
level.
as I say, in 2008, you didn't give 1 cent. Now when we are giving, you're asking to raise it.
Honorable Béranger.
Thank you, Mr. Speaker. I think we all agree that déconfinement must take place par étapes et par secteur. But I would like to put one point before the Prime Minister, that is, reste la case obligatoire. This is very heavy on the freedom, on the health of les citoyens en général. In next door, Seychelles, if I may refer to Seychelles, they introduced reste la case obligatoire on the 8th of April. And it was raised yesterday, because in the meantime, there have been no new cases.
Your question?
Now, my question is, if we keep reste la case obligatoire until the 1st of June, although we hope there is no new case in the meantime, does the Prime Minister feel it acceptable that we will have kept reste la case obligatoire for 5 weeks?
Mr. Speaker, sir, I think some people still do not realize how serious and how dangerous this COVID-19 is. You know, the most effective way of fighting COVID-19 is a lockdown. The most effective. The most effective way of fighting it is reste la case. And it doesn't apply only to Mauritius. It applies to the whole world. I think by reste la case, we have been able to even be informed about what is happening elsewhere. Now, do you think it is a pleasure for me as Prime Minister, for this government, to lock down initially and to tell people that be cautious, you have to stay at home? Because the danger is that since it is a virus, we can't see it, we don't know who is infected, and we can easily catch it. Therefore, as I say, there is a balance. On the balance, you know, there is on one hand the health of the population, everybody's health. On the other hand, of course, the inconvenience that everybody will entail by staying at home, by not going to work, by not earning a salary, and so on. So we have to weigh. And on that weighing machine, well, of course, the health of the people, for us as a government, I don't know for others, but for us as a government, it, of course, outweighs everything else. That is why we have to sacrifice. We have, unfortunately, for a period of time, what we are saying, 5 weeks. I agree, but we have all witnessed how our children, for example, have been at home and staying at home and not being able, and some of us even live in very confined places also. But it is, unfortunately, it was necessary. And now what we are doing, we are allowing, comme on dit petit à petit, a number of activities to be carried out. And we hope, because this is the advice that has been given to us, and I see that it is also being practiced in so many countries, I can't say for every, in so many countries, that, for example, those who need to remain at home for the time being are people who are below the age of 18, as we have suggested. We have also suggested that people who are above the age of 60, especially those who are already enjoying not a very good health, they are the most vulnerable, and they should be taking even more precaution. So there is some sensitization campaign that they should not be going out, unless, of course, unless it is necessary, unless they have to go to work, then whereby they will get a permit, you know, to attend to their place of work. But otherwise, I do not agree that, you know, we should have lifted this, or lifted this sanitary curfew, and allow, you know, many more people to circulate. This is the danger. And this is what Singapore has done. Not only Singapore, some other countries also. They started well. They reached a point where, you know, the figures were so much indicative of an improvement in the situation that they started to relax suddenly, and then there was a resurgence. And this is what we don't want to happen in Mauritius.
Time over by 8 minutes.